All right, we are live. Good evening, everybody. This is Dr. Michael Kay from the Center for Functional Health, and I've been looking forward to tonight as I will be speaking with Dr. Steve Tyssee. He's a physical therapist. He is the CEO of Peak Orthopedics and Peak Total Wellness. Steve, welcome, welcome. I hope you're having a great evening. You live in a fantastic area. You live in sunny California. Right now, we're getting, believe it or not, some sleet and rain. So
Oh,
we're envious of you that where you're at. It's a beautiful area there. So I love to hear people's origin stories, right? When we talk about superheroes and you're a superhero in the health world, and I want to know your origin story. How, as a physical therapist, which makes sense to you and I, you
yeah,
get into this
yeah,
functional medicine, this functional wellness world.
right.
So, how the heck did that happen?
Yeah. Well, first of all, I want to thank you for having me on. I really appreciate the opportunity to come on and share my story, because as being in this profession and then even moving into the functional medicine space, we just have this deep passion to try to help people and to really do whatever we can do to try to help. And I'm sure you're just like me. We give away we give away so much
Mhm.
information and help and knowledge, and we try to share it because our drive is to help people. Um, and so I appreciate the time that we have together, and thanks for having me on. So how I got into where I'm at, I always say, so to kind of go back to my beginning of physical therapy. So before I was a physical therapist, I was in the sports medicine world. So I'm a certified athletic trainer, and I worked in the athletic world almost solely for about 7 years before I went into physical therapy school and ended up in the physical therapy profession. And, from there, we're always dealing with inflammation. Um, if it was the injured athlete, or if it was the person coming into the clinic. So we're always dealing with inflammation. And what really, I think, kickstarted a lot of it was, was the big opioid epidemic. So a lot of people started to get turned off, and rightfully so, of medication. And so I started to get more and more questions of what can I do besides take the medication to help with my pain, to help with my inflammation, to help me heal faster. And so drawing on my sports medicine background, because in that world, there's a lot of talk about nutrition, pre-game meals, post-game meals, recovery meals. So there's a lot of talk in the sports medicine space on nutrition. So it was a pretty easy transition for me to start to talk to my physical therapy patients about anti-inflammatory diets and things to avoid eating that we just know are not good for us. And that kind of led me into studying more about nutrition. And then it became like the rabbit hole situation, I started reading more about dietary and nutrition, and then you start reading about foods that cause inflammation, and then you keep reading about foods that promote healing, and then all of a sudden you start reading about all these other situations that create inflammation, insulin resistance, stress, lack of sleep. And I'm like, oh my gosh, there's like all these things I have to learn about. So I just kept reading more and reading more and reading more and trying to find ways that I can help my own patients and get better and maximize everything. And and then I kind of say I became my own patient in a way. Um, so I have three physical therapy clinics now, and about 7 years ago was when I opened up my second office. And coincidentally, around that time, I was starting to have, I'm a runner, I'm a soccer player, I'm pretty athletic. But around that time, I was having both my ankles were always sore and painful. My knee was always painful. I was having back problems. My stomach was having issues. 2, 3 o'clock in the afternoon, I was just exhausted. And I was just drinking coffee just to get through the rest of my day. So just generally not feeling good. But I said I just felt like crap all the time.
Mhm.
Um, no surprise. I go to my doctor because of all these things, and he's like, you know what, Steve? All your labs came back looking pretty normal. I was like, well, I know something's wrong. So I say, I do what any good type A controlling person does, right? I did it myself.
Right.
So I really dove into nutrition and functional medicine. And about 7 or 8 years ago, that's when gut health started to become more of a topic of conversation too. Um, and then all of a sudden I found like functional medicine did all of these things in one entity that I was trying to find all over the place. And so that's when I really did dive into functional medicine, became a functional medicine provider, and I really did help myself through those programs. So then I've kind of perfected that over the last 5, 7 years, and really try to streamline my own program. So that's like my long story to my journey, but we all have a journey and a path.
Right.
And
And the journey continues, So,
yeah.
I mean, here you are, an individual who, is well educated, well schooled in the body, right? And you're experiencing all this kind of discomfort, not realizing that, wow, it's probably just due to this underlying inflammation. There's a multifactorial, complex that's
Mhm.
happening to you. So when
Yeah.
you're looking at it and you take a step back from the conventional medicine, what was one of the first things that you did for yourself that you felt, wow, this kind of really moved that health needle forward?
Yeah, that's a really, really good question because there's always some beginning thing
Right.
where it worked, you know? And I think it was um, dairy. For me, it was dairy. Um, my sister-in-law gave us a book about the dairy and the dairy industry, and I bring this up to my clients now. But in the book, it's like we're the only species on the planet that drinks another species' milk. And then when you think about that, it sounds kind of gross, you know? It's like, oh yeah, like that's weird, you
Right.
know? Um, and so I wouldn't say I was 100% dairy free, but I definitely, milk was gone, cheese was sporadic. And so I really got off dairy probably 80 to 90%. Um, and that was probably the beginning really of like, wow, you know what? I feel better, you know, and getting off of dairy. And then I got off of, I wouldn't say I got off of gluten, but I really did get away from eating, my my turkey sandwich at lunch, the typical lunch, the turkey sandwich at lunch, the ham sandwich at lunch, the deli meat kind of a thing at lunch.
Right.
Um, and that's really was like, wow, like I'm feeling so much better as the day goes on. I'm not feeling as bad as I did. And that was kind of the beginning of looking a little bit more detail into some of these things of there, maybe there's something to this.
So did you find that when you cut out dairy, and of course you cut out, gluten, or you modify the gluten,
Yeah.
was it the joint pain that lessened for you first, or was it more of the brain fog? Because I find when I'm dealing with my patients, we go on an elimination protocol,
Mm-hmm.
like
Mm-hmm.
8 and 10 days into it, they often say, like, I didn't know how brain fog I was until it
Yeah.
lifted, right? So I
Yeah.
mean, you can
Yeah.
imagine, you see, we didn't even do anything special other than we said, please stop eating all this junk,
Yeah.
moving into like a whole food type of setting. So for you, when you were going through this, like,
Mm-hmm.
when did joint pain become less, and when did brain fog become less? When
Well,
that fatigue improved?
the joint pain kind of stuck with me. Um, but it was the energy. It was the mental focus. It was that 2 o'clock in the afternoon energy crash. Those two things kind of went away. Um, and I was really starting to feel like a lot better. And my wife would tell me, and I always blamed it, we all blame it on something, right?
Right.
So I always blamed my headaches, my tension related stuff on like the weather, the pressure changes. I get a headache if it goes from cold weather to dry weather, if it goes from the rain to the sunshine, like those pressure changes. And it was a while later when my wife was like, you know what? You haven't complained of a headache for like 6 months. And
Right.
and I'm thinking about it, I'm going, wow, you know what? You're right. But I also stopped all these things. And so I didn't really put, two and two together as much at that time. But there was definitely the energy factor, and that end of the day, I could keep on working. I wasn't feeling like I had to go home and take a nap. I wasn't getting the headaches because my wife told me so, and so those were like some of the things that really made me start to stick with in terms of forever, like long term now. But even, okay, this works. And that's something where I tell my clients now that, don't think you have to do my big, full blown, high dollar program. Just 2 or 3 small changes are going to have a huge impact.
Right.
And I think that's an important thing to realize as, you and I as practitioners, where we're thinking, well, we can do all these things with you. But as you scale back, it's like, if you can just do these 1 or 2 things, you'll improve. And sometimes that creates the buy-in for them to do more, because some people really do have a hard time giving up their sugar or giving up their rice. Or I have somebody who's old school Italian who just joined my program, and she is freaking out about not eating pasta,
Right.
So you can do it. Small pieces and small changes have a humongous impact.
For sure. So but you don't experience joint pain anymore, do you? I mean,
now I don't know. I went like full bore into the functional medicine, lab testing, gut health testing. It's funny because I share with my clients when I get their lab results back, and I'm like, you know what? My labs were worse than yours. And they look at me and they're like, really? I said, yeah, I don't know why, but my labs look worse. So
what did you find on your lab tests that really said, okay, wow, I see this. This is either a deficiency in X or too much of something, right?
Right.
That you thought, okay, I got to change this, and you changed it.
Yeah, 2 things for me. I primarily do adrenal labs for stress hormone, and looking at our stress response. And then I do the gut health check, looking at bacteria balance and gut health, and if our gut's inflamed, and some of those things that we look at in gut health lab tests. And my stress response was not good. It was just depleted. And then my bacteria balance was really out of whack. I really had a lot of bad bacteria built up. I had a big, what they call dysbiosis. So it had a big balance in there. And, in the functional medicine space, when we do our assessments, we look at stress. And we not only look at stress, but we also look at, antibiotics, medications you might have been on over your time. And when I go back to my own history, I was chronic tonsillitis as a kid. I had my appendix taken out when I was like 7 years old. And of course, back in those days with kids, when they take out appendix or you have procedures, I don't know how well they did pediatric doses of stuff,
Probably. And
And
you don't
so
need to
I
have
was
appendix
probably,
anyway.
yeah, exactly. I was probably slammed with antibiotics as a
Sure.
kid, 5, 6, 7 years old, always on antibiotics because I had like developing tonsillitis related issues as a kid. So I was probably just hammered with antibiotics as a kid. And knowing what I don't know now, and looking back at that history of my childhood, it's like, wow, I was set up for having some level of gut dysfunction. And then, as I said earlier, what really kicked it for me was opening up my second office. And that triggering stress event is what kicked me over the edge. That was what we want to call, the straw that broke the camel's back approach, where I had all these underlying things going on. Nothing was bad. Nothing was really out of control. They weren't good, but it took that one triggering event of opening up my second office and going through that level of stress that really kicked everything in motion. And so that's kind of where you look at the functional medicine and you look at my history. It's like, wow, I can see why I ended up where I am today.
And we'll see that in patients where, they say, like, listen, I know functional medicine is about root cause medicine, right? What started it. And
Mhm.
if we get lucky and we get a really good history, sometimes we can figure out what started it.
Yeah.
And there's those events. I mean, stress of buying a house, the stress of losing a job and getting a job, having a child, going through a divorce. There's a death in the family. There's all these triggering events that we also don't think, well, it was nothing. It's just part of life.
Yeah.
Then you take that big hit, so we
Yeah.
see that. But sometimes we say, okay, well, we don't know what started it, but here's what we know now with your symptoms, so here's how we can address it. And I think one of the things that is often overlooked is sleep. And how
Mhm.
did sleep or lack thereof play a role in your presentation?
Yeah. Yeah. Sleep is a big one. Sleep is a big one. And especially coming from the physical therapy, um, because, people are in pain. They're coming to us because they're having pain, whatever it is. They had a total hip surgery. They can't lay on their side and sleep. They had a total knee surgery. They had a car accident. Um, whatever the case might be, their pain um, is disrupting their sleep. And sometimes people just have natural sleep issues, which, is also not beneficial. But, um, when when our patients aren't able to sleep, they're not able to heal themselves with um, their own body's ability. And we talk about stress. Um, in my educational modules that we have in our program, we go a lot into the stress and the rest and repair and recover. And that system is what they call the autonomic nervous system. And, that's our stress, which is our fight or flight. And then we have the other side, which is what they call the parasympathetic. That's our healing, recovery, repair. But the interesting thing about our autonomic nervous system is it can only do one thing at one time. You cannot be all stressed out and be in a healing, um, a nervous system. You just cannot do both. And that's why practicing gratitude um, and mindfulness is so important, because you can shift from that stress side into the healing recovery side. And with sleep, when we're in that level of deep sleep, that's when that parasympathetic nervous system is just through the roof in high gear. And there's no stress. The sympathetic side of our nervous system, which is the stress side, is just shut down. And we're at that deep sleep and that high quality sleep, that parasympathetic nervous system responsible for health, healing, repair, recovery. That nervous system is just, ramped up in high gear. And so if you're not getting good sleep, you just cannot heal and recover, because your body is not able to go through that process. And so that's why sleep is just so important. And so in our world, when you're dealing with pain along with sleep, there's a lot of talk about strategies to help minimize your pain so you can sleep.
Right. So what do you say to your patient? I mean, it's a common one in our office where, and it's more female than male, where the female will say, "Hey, at 2 or 3 in the morning, my eyes just pop open and I
Yeah.
cannot get back to sleep." Where with a lot of our older guys over the age of 50, it's kind of like, I got to get up and I got to urinate. I got to get up and I got to
Yeah.
urinate.
I know. I know.
We got to look at that prostate, from that
The only
perspective.
time I get up and I go to the bathroom.
Right, exactly. So what do you say to our, the female clientele that says, listen, I mean, 2 or 3 in the morning, man, my eyes pop open and now I can't get back to sleep. And that's a common one that we get in our office.
Yeah, that's a common one. My first go-to when they bring that up is we talk about some of the deep breathing exercises. Um, and I'll talk to them about if they want to lie there and do some deep breathing. There's one of the things that I like to talk about is what's called the box breathing.
Mhm.
It's a everything's 4 seconds, so it's pretty easy to remember, and it's a vagal nerve stimulation, which helps our body relax. And the deep breathing is, a 4-second inhale, a full inhale, hold it for a count of 4 seconds, and then you exhale for a 4-second exhale and push it all out. And then you hold that for about 4 seconds. And then you do another 4-second inhale, hold it for 4 seconds, and you do that cycle 4 times. They call that box breathing. And it's a way to try to just get yourself to calm down. So that's typically one of the first things I talk to somebody about, is trying to do some of those deep breathings. And from there, we talk about counting your breaths, a couple of different strategies on just counting your breaths and focusing on your breath as a relaxation technique. So those are my first go-tos when somebody has those type of, like you say, they wake up and it's like, I'm wide awake.
Yeah. And then when they need to fall back to sleep, it's only an hour or 2, if they're lucky, of that deep sleep.
Yeah.
And we know that interruption of the second half of sleep leads to more dysfunction than if the first half was interrupted.
Yeah.
So we really want to try to do that. So do you use any supplements from, melatonin to GABA to, magnesium to help them sleep or anything like that?
Yeah. The one thing I tell somebody is just to do magnesium. That tends to me, because I think I go to that too, because when you're talking about somebody who's in pain, the brain doesn't like pain. So when you're having pain, the brain tells the muscles to tense up to try to protect the pain area. And so magnesium is kind of one of those natural relaxers. So I think I've always gone to magnesium because of not only relaxing the body in general, but also those tensions that are being created because of the pain. So I'll tend to go to a magnesium first.
And do you like a magnesium, citrate? Do you do a malic glycinate? Do you do a complex? What do you use?
I usually recommend the magnesium glycinate.
Okay.
So that's what I go to. I find it works better than, some of the others out there.
Yeah, I just started with about 6 months ago the magnesium bioptimizers.
Oh, okay.
I don't know if you've seen those. They got a complex, like a magnesium complex. I think it has like 7 different types of magnesiums in there. So those have been pretty interesting.
Yeah.
I find that a lot of times, and you can speak to this, patients come in with just bottles of junk, just bottles and bottles of junk.
I know. When in my functional medicine, everybody has their philosophy. Excuse me. I think everybody has their kind of philosophy and approach. And my 2 big ones are, of course, food is medicine.
Right.
And then lifestyle changes to support that positive, healthy lifestyle. And when it comes to supplementation, I primarily supplement based on lab tests. So I'm not a big believer in just supplementing randomly. Now, there's some supplements we know are going to be beneficial for everybody. Like if you're having problems sleeping, go for magnesium. Vitamin D is always good. A good B complex is always good. A good multivitamin is good. But when you start to get into this collection of other supplements that are out there, I'm a big believer in supplementing based on lab tests. And this is what I talk to my potential clients on. It's using the lab test, using our supplements, and then, balancing out our body systems, getting to a food as medicine and lifestyle approach, and ultimately transitioning out of supplements and rebalancing our systems and getting on, laying that foundation of food as medicine and lifestyle approaches. So it's true when I get people that come in and they break out their list of 11, 12, 15 supplements. My first question is, why are you taking them?
Right.
After I go down the list and I'm like, this one is the same as this. This is the same as this. And so sometimes people don't realize what they're taking. They're taking it in another supplement as well.
Correct.
So
And you can't over supplement too.
yeah,
Can't
yeah,
do that.
yeah. I actually had somebody, she didn't join my program, but she's still trying to figure it out. She was having, she like OD'd, I guess. Um, I'm trying to think of the phrase. Oh, like toxicity, vitamin B toxicity.
B
So
or
she
D?
was having all kind of neurological related issues
B.
from B.
From
Yeah,
B. Yeah. Yeah.
yeah,
She's getting B6 a lot.
yeah, exactly. So because somebody told her to take B6 for something else.
Right.
And so she was taking some big mega along with another solution that had mega dose of it in there. And so it's almost like quadruple the level that she was taking.
Right.
So, people don't always realize what they're taking. And I've even had clients who came from another functional medicine practitioner who were on certain supplements for like 3 to 4 years. And it was like, why are you still taking that? And even like probiotics. Like I've had people come in taking a bunch of probiotics. We do a gut health check, and I'm like, stop taking probiotics. Like you actually look pretty good, but you've got a terrible yeast buildup.
Right.
Like your probiotics are fine. Your bacteria balance is not that bad, but you've got a really significant candida situation going on. So you're taking stuff you don't need, and you're not taking stuff that you really do need. So you find that a lot in people who come with their list of supplements without any reason.
Right, right. And listen, we get patients, complain about, conventional medicine. Like every time I go, they just give me a medicine for my symptom. And then we have people go to functional medicine docs. Like every time I go, they just give me a vitamin for my symptom. I'm like,
yeah,
kind of like the same thing, right? And they're not taking like the larger picture look of it. So, I find that very interesting. So
yeah,
63 is the number I'm giving you. 63 is one of my patients. That is how many supplements he was taking when he walked into the office.
wow.
That included homeopathic remedies, blended supplements, individual supplements, tinctures. It
That's
was
amazing.
just humongous. Now we're down to
100,000
like
keep. Yeah,
and he
yeah.
says, my gut bothers me. And I was like, no, really?
Yeah,
So
but I haven't really come across. I have one client, not a client, but a physical therapy patient who is in that kind of mindset, I guess, taking multiple things, and nothing adds up, nothing makes sense, and that's the kind of person where there are people you need to say no to, and that's somebody I have to say no to because I think sometimes there's something else going on. If it's a psychological situation, if it's everybody has certain levels of addiction related issues, and so those are people that really need something more deep, psychotherapy maybe. But yeah, it's I've had a couple of those, and that's not my space. And so I just, that's not something that, gosh, yeah, you hear those stories, and it's like, oh, that's not my arena.
right, right. And I will say, like, because we see a lot of gut, a lot of autoimmune. Often there's underlying trauma that was never addressed, and that's
Right.
one of the conversation I had with our colleague, Dr. Colin Traskos. I mean, it's important, and that's not in my wheelhouse, so I got to refer that out. But I
Right.
think the fact that we recognize and say, okay, here's some additional help, because
Yeah,
I know when I
definitely,
can
definitely.
address that, it helps in the long run. Their symptoms do change for the better. So I think that that's really important.
Yeah, yeah, it's true.
As a physical therapist, I mean, you also, you've seen a lot of people who suffer with, the arthritides, right? So, you think about like osteoarthritis, think about rheumatoid arthritis, and
Yeah,
in the conventional medicine world is like, just go take this medication.
yeah,
And
yeah,
they'll leave them with that. And like, is there something else I can take? Especially like, think about like autoimmune, like psoriatic arthritis, right?
right.
I mean, it affects
Big.
not just the skin, it affects the joint. I mean,
Yeah,
whiter symptoms, all these things is like, well, here's the med. And then they
Mm-hmm.
come to people like us, we're the manual guys, and it's kind of like,
Yeah.
okay, so we can work on this end. So when you see that in your office, how do you get that message across, especially to like somebody who just had a DEXA scan, that DEXA scan comes back atrocious,
Yeah. I
like,
know.
hey, here's this functional medicine world that
Mm-hmm.
can help you.
Yeah. And I think that is why the transition from physical therapy into functional medicine was so easy because, as you know as well, only recently, 2014, 2017, have they finally done MRI studies on the normal pain-free population. And, guess what? Like, we're all screwed up. We all have problems. We all have disc herniations. We
Yeah.
all have meniscus tears, rotator cuff tears. Um, but, in the physical therapy, dealing with a lot of those things, like therapy can take care of it and you don't always need a surgery. And, when you look at partial rotator cuff tears or meniscus tears with osteoarthritis, physical therapy is about 70% successful at getting you back to near 100%. Surgery is only about 70% successful. So, the success rate of the physical therapy approach is great. And what I tell my patients who are debating on surgeries, we talk about those studies that came out that we all have stuff that you're finding, but then also, you have to understand your orthopedic surgeon went to school to be a surgeon. Um, Everything he learned was all the diagnostic tools to see if you need a surgery. And when they graduated and started practicing as an orthopedic surgeon, all the research that they're reading, all the seminars that they're going to, all of the continuing education programs are going to are the latest and greatest diagnostic tool and the newest surgical techniques. They're not reading all of that body of research in the physical therapy arena right now of ways to prevent a surgery. Like, they're not looking and reading that information. That's not a negative to them.
Right.
That's just where their focus is. And the functional medicine leap was the exact same thing. It's the medical doctors went to med school to learn the diagnostic tests, the lab work to do, the medications that related to these positive findings on lab work. And they graduated, became a practicing doctor. And same thing, all the education, all their research is the newest blood tests coming out and the newest medications. They're not reading all that body of research that's come out of nutrition, lifestyle changes, of ways that you can not only improve, but in a lot of cases, even reverse a lot of these chronic diseases. And again, you can't blame the medical profession because that's what they went to school to learn. So it was a pretty easy jump to go into that. And so, when you're dealing with some of your osteoarthritis patients, we kind of talk about the surgical path first, but then trying to get them to understand, this other approach of functional medicine and nutrition changes. And, it's interesting because when I first started promoting functional medicine to my physical therapy patients, ways to help their pain, ways to help their inflammation, ways to help their energy, it didn't click. And I always say, I think that it's too much of an abstract concept for people to wrap their head around. Like, just making these changes is going to make me better, but a great big side effect of all this stuff that we do is people drop 15, 20, 25 pounds. So one of the big things that people will say is, I know if I drop this extra weight, my knee will feel better.
Right.
And I said, oh, that's what I do. And we talk about weight loss and helping them drop the weight and put them on an anti-inflammatory, nutrient-rich, healing diet. And then they say, oh, that sounds great. because I know I need to lose the weight. And if it will help my inflammation, that's good.
Right.
And so I kind of move at it at that angle. And that's given me a lot more success because I think dropping 15 pounds is more concrete for people to grasp that I'll feel better.
Right. I know for us, and maybe it's happening where you're at too, like the orthos I work with, they'll tell the patient, like, we're not going to replace that knee or that hip until you lose like 25 pounds, 50
Yeah.
pounds, because we're not going
Yep.
to do it. I mean, because we're going to do it and you're just going to muck up that work.
Yeah. And they want to be successful.
Exactly. Right.
Yeah.
So, again, that's where I think what we do plays a large role, even from that perspective. Now, I love when I told a patient about inflammation, or go, really? And I'm like, okay, and they're dealing with a shoulder problem. Like, we'll get you on a medral dose pack.
Yeah.
They get on the medral dose pack and they go, yeah, my knees feel great. I'm like, yeah, but you're on it for your shoulder. Yeah, my shoulder feels good too.
I
So
know.
overall, when we decrease inflammation, you feel good. They're like,
Yeah.
yeah, okay, I get it, right?
Yeah, I know.
That's a great sign when that happens.
Yeah, I
So,
know.
when you're dealing with a patient that has rheumatoid arthritis, maybe you can talk a little about rheumatoid arthritis and how your approach, both from a physical therapy perspective and also from a functional medicine perspective, can come together. Because a lot of times I think, when people go to me as a manual therapist, they're like, oh, he's just going to work on my soft tissue. It's kind of like a massage. It isn't. It's more myofascial release. Or I'm going to go to a chiropractor. He's going to crack my back. I'm going to a physical therapist. Every time I go to a physical therapist, they put me on this upper body ergometer. No balance into it, right? I go to a doctor. He doesn't give me medicine. So it's the same thing.
Yeah.
And they're frustrated, and I get it, but they also have to do the work. So when you see somebody that has rheumatoid arthritis, which can really super compromise activities of daily living, simple things from opening a jar to buttoning your shirt to pulling up a zipper, how do you look at them from that perspective of, okay, here's what we're going to do manually. Here's what we're going to do from a strengthening or stretching perspective. And here's what we're going to do from a functional perspective.
Yeah. 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 It's interesting because people have to be ready for that conversation. And I think that's what's always so frustrating for me is when you see all of these things and how much you can help, but they're not open and receptive to making some of those changes. And I kind of like make the comments when they're not ready. And I don't know, I do it to try to make their brain trip to say, typically when people sign on to my program and look at nutrition and look at some other things that might be contributing to your RA, they kind of have to hit this rock bottom moment and they're really bad off. And, don't wait till you have this rock bottom moment. And I say that to try to people understand what rock bottom means. And so I try to say that to get them to start to think a little bit more open-minded about making some changes. And everybody's rock bottom is different. Some people don't want to be on medication for the rest of their lives. Like that's their line. Some people it's, the doctor says, if you don't make these changes, we're going to have to start having you do daily injections. Like, oh, I'll take pills, but I don't want to do a daily injection. Right. So everybody has a rock bottom moment. And that's where, like I said earlier, when there's those people who are not really ready, I try to find out where they're at. You always say, meet them where they are. Try to find out where they're at and just giving them those small changes. Find out what they're normally eating, even find out what their stress level is like, find out what their sleeping is like. And then just slowly give them handouts, to start to look at, oh, well, here's something on food and inflammation. And this is my, anti-inflammatory food list and some things just to really try to limit. I don't say avoid, because then it's like, they don't want to talk to you, but right. limit your gluten. Just try to go gluten-free, just, Monday and Tuesday, pick a couple of days, and so sometimes I'll just get those people who aren't ready to start to make a couple of little changes and see how they feel. The nice thing about physical therapy is same with chiropractic care. We're in a very, very unique situation where we actually can see the person 2 times a week, maybe 1 time a week for, an episode of care, if it's 3 weeks, 6 weeks, 8 weeks. So you really get a check-in and you really get the ability to, like, how did you do last week? And you really can create that level of dialogue. And the ones that start to listen and change their habits, they all feel better. And it's always surprises me, as much as I've been doing this forever, it's still like a miracle. It's like, wow, it really works. That's amazing. It's like, I know it does, but it still just amazes me that it works.
Right.
But it is, you have to get them to buy in at the beginning. And some people, you bring it up and within 2 minutes, they're like, oh, I want to join your program. So that's the spectrum you're dealing with in the clinical side. And when they're ready, they join in. When they're not, you've got to give them something, and hopefully they'll start to do a little bit of reading on their own.
Can we talk a little bit about osteoporosis and DEXA scans and why they play a role? And although there may not be a large inflammation factor in osteoporosis, I do have patients that come in and say, well, I'm taking my calcium. I take calcium supplements. And you're like, oh my God.
Yeah.
It doesn't work like that. You can swallow all the calcium supplements.
Yeah. It's a whole body approach. I mean, like I tell people all the time, it's a whole nutritional approach. It's not just calcium. You've got to get vitamin D in there. You got to work on your inflammations and your insulin resistances that are happening in the body to let that whole process happening. But, one thing alone doesn't do it. You've got to start to go into the ways to stimulate the bones with exercise and activities and things like that. And it's amazing how many people just don't eat nutrient rich, high value foods. And that's a big one. And so many people think that they can just do the medicines and improve. And God, the number of people who are doing higher level of medications, the different injectables that are out there to try to help their bones. They're not doing this whole other collection of stuff, which is so easy and basic, with exercise, with strength training, with getting on a proper nutrition program, dealing with some of their issues with stress and sleep. And so many of those things just can improve the whole health of the body, getting the right level of proteins in the body, not only with osteoporosis, but you've got sarcopenia, which is where the muscles begin to break down as we age. And so many people just chalk it up to, I'm getting older.
Yeah.
And it's like, no, it's not age. It's your eating and lifestyle that's creating it. Your age is a factor, but it's a small factor.
I have to say, strength training is so important, right? I mean, if you come to me and there's autoimmune, we're eventually going to talk about strength training. If you come to me and you have cardiometabolic issues, we're eventually going to talk about strength training. You come to me with that, we're eventually going to talk about strength training, right? Because, to my knowledge, there has not been an article, a meta-analysis, a randomized controlled trial that said, hey, strength training is bad. Now, obviously, we have to find what works for you in your given presentation, but I think you have to put in the work. You have to, you have to get strong, and that's the goal of almost any program. Let's get you out of pain. Let's get you healthy. Let's get you optimal. Let's get you strong. Because strong wins the day for sure.
I know, and it's funny because, being athletic, being in sports, big into exercise. I've been open now. My first clinic was 20 years ago. I opened. About 15 years ago, we started a medical exercise program. within our office. So now 2 of my offices have a fitness center within there. And we started that whole process for chronic disease management, for decreasing waist circumference, for decreasing body fat, working on cardiovascular health, working on balance fall programs, osteoporosis programs, cardiovascular programs. So that's something that we've been in that exercise space and promotion for 15 years now. And so now within the clinical model, we're bringing all that together. And it's funny because in the fitness industry, like you say, there's no great body of research. I wouldn't say body of research, but it's real live type studies. They do clinical trials and then they say exercise is beneficial,
Right.
and then it stops. There's not this ongoing long-term body of research to really show it and prove it in a way, and which is really kind of interesting in the exercise and fitness world. And they're getting a little bit better at it now, but 15 years ago, they would do studies to say, yes, exercise helps cardiovascular disease, but then there was no real long-term clinical studies. It was just more research-based studies. But now they've been able to identify, when it comes to chronic diseases, there's only 4 data points that can look at that have proved chronic diseases. It's cardiovascular, like a cardiac, we do a 6-minute treadmill test. It's waist circumference. It's percent body fat and BMI. So those are the only 4 data points that can say where you're at risk for any level of chronic diseases out there. And it's really interesting that that's it. Of everything that we do, those are the only 4 data points that they've been able to consistently identify in research, that if we can change those 4 markers, you're going to be at a much lower risk for autoimmune, for diabetes, for cardiovascular disease, for cancers. And there's a lot of research right now going on in the Alzheimer's dementia world now about the same thing. And so it's really a pretty fascinating time that we're in for moving medicine forward, really.
Yeah, it's moving health forward.
Yeah, exactly. Moving health forward.
Moving health forward, right? So when we talk about exercise, though, I think it's important. We've had patients who were just hammering it out on the treadmill, day after day, and but they weren't really moving that health forward. In fact, it was working against them, right? When you take a look at some of these, super cool high-end athletes, there's like underlying problems sometimes, from joint issues to AFib and stuff like that. So
it's
when you're working with your patients, what blend or portion do you have? Like, hey, here's how much cardio I'm looking for. Here's how much strength I'm looking for. When you see them, what is your goal?
Yeah, we really promote strength training, like you were saying. And, the era of fitness, the era of the big box gyms that are out there, and this is what I tell patients, it was the fitness industry kind of hung its hat on fitness for weight loss. That's what really tried to promote the big box gyms 25, 30 years ago. 25, 30 years ago is a lot of small local gyms, little fitness centers, tennis clubs, racquetball clubs. It was more like that. And then some weight room type stuff. But then the big box gyms came into play, and trying to find ways to get members to go to the gym. That's when they sold the public on, the calorie in, calorie out approach. And so you need to burn your calories, and that's through cardio. And these gyms created all these massive cardio, facilities with bikes. And, you and I are old enough to remember the old NordiTrack, cross-country skier.
Yeah.
I tell people that's the elliptical.
Exactly.
They kept trying to reinvent the same cardio equipment to try to convince you that that's weight loss, and it's not. And then, like you talk about the high intensity people, we talk about how stress can create dysfunctions. Stress can cause us and trigger us to hold on to body fat. And, the interesting thing about stress is that it doesn't matter how it comes into our brain. Our
Hmm.
brain's chemical reaction to that stress is exactly the same every time. So if you're doing that high intensity exercise and you're putting yourself under some undue exercise stress, that's causing your body to hold on to body fat. So you're going against yourself.
Right.
And then I'll tell them, of course, when you first started doing that, you probably dropped 5 or 10 pounds, but you stopped because you lost a bunch of water weight because you're sweating like crazy. But in terms of body fat, you're actually gaining more body fat now because you're putting yourself under so much excess stress. And that stress is what's driving it all. In getting people to understand that concept and that relationship to stress and weight gain, or stress and inflammation, or stress and gut health, and that high intensity exercise, they start to realize that. And that's the education we have to go through, because these people have been doing that for 15 years,
Right.
and they've read every article and every guru out there. And now I'm coming along telling them, like rocking their world.
Right.
Like, no, that doesn't happen. All right, well, keep doing it.
Right. Right. We'll see you sooner or later. Yeah. For me,
Yeah,
I have
yeah,
people like on the treadmill, like I can do the treadmill for like 30 minutes and 40 minutes. I'm like, great, here's a jump rope.
yeah,
Never last, right? So,
yeah.
you talk about people who are buying, the Peloton, which is an incredible, amazing piece of engineering machinery, the Peloton or the rowers, the HydroFlow, the
Oh,
robotic.
yeah, yeah.
I mean, top of the line, the engineering compared to what you and I grew up with, here's a
I
universal
know.
machine, right? So, I mean, these machines here are for cardio, and I'm a big fan of rowing. I think rowing just covers all our bases
It's a
for
big full body.
a
Yeah.
full body, from a core to joint to cardio to mobility. I think, rowing is really phenomenal, but we just all have to start somewhere. And they're so used to like, well, I heard this. I'm like, okay, you heard this, but for your clinical presentation, you need to do this.
Yeah, it's true. And I think that's where that personalized, customized type of medicine is so key. And, I mean, that's what's missing. Part of our fitness, we do an assessment. We do reassessments every 3 months. Our first assessment, we do the assessment, which brings in multiple things. And then we sit down and what are your goals and what are your objectives? And then we lay a program out based on that stuff. And it's the same thing with our nutritional model, and it's the same thing with the supplements, and it's the same thing with the lifestyle components. It really is personalized care, which is awesome. But when you want to look at maybe the negatives to that, is it's very costly. It's time consuming for the practitioner to really provide that type of care. The insurances
Mm,
don't want to put money towards it.
mm-mm.
So it's really a tough bind that like you and I are in, because it is very time consuming to really create these programs
Yes.
specifically for what your issues are. Um, because it's very timely, and then of course it's expensive, and it creates a big barrier for people really getting the help that they need, um, because of that. And it is customized care, and I don't know, until the medical world or not the medical world, the insurance world, I would say,
Mhm.
realize, wow, if I could put $2,000, $3,000 a year to make you healthy, I'm going to save $10,000 on the back end.
Right.
Like, easy. I mean, I read this somewhere, I forget where, the biggest expense for the insurance industry is pharmaceuticals.
Yep.
That's their biggest expense. So why don't you spend $3,000-$4,000 a member and get them super healthy, you're going to save $10, $15, $20,000, and don't even talk about cost of surgeries and hospitalizations.
Right.
What
So
am I missing in this model?
right. It's that end, though. The pharmaceutical, as you company, as you well know, lobby is strong, and
Yeah.
they're,
Oh,
they're
yeah.
they're a business as well. It is what
Yeah.
it is. So, can you share what is the process like? When somebody calls you, I mean, aside from the traditional physical therapy, your process, because
Mhm.
you don't, as you have offices and you have moved more into that functional medicine world. So can you
Right.
walk us through the process of what it's like when a patient calls you and where do they go next and what do you do for them and all that?
Yeah. Now I don't treat in the physical therapy clinic. I just do wellness and functional medicine programs now, but my whole staff knows what we do. And so they're like, this person needs to talk to you. Um, First, I just do a 30 or so minute, just complimentary type of a consultation. Largely, it's me trying to assess their readiness, um, because it is a commitment. It's easy, it's simple. My programs are straightforward and easy to follow, but you have to make the commitment, commit to the process, commit to eating certain ways for about a 5 or 6 week period of time, committing to avoiding certain type of foods for a short period of time, so you really have to be committed to the process. And because I found if they're not committed, I'm working twice as hard trying to make them commit, and nobody's successful and nobody's happy. So I kind of always do an initial consultation just to make sure they're ready to commit. And then I have what I call my 3-pillar process. It's inflammation control. So we have to figure out where the inflammation's coming from in the first place. And that's where we can do lab tests if you want to do lab tests. Um, um, and then the second thing is lifestyle management. So we have to look at those lifestyles and move into a positive, healthy, healing mindset in lifestyle. And then the third part of it is nutrition programming. So we have to try to identify what foods you might be having issues and sensitivities with. And then we have to move into an anti-inflammatory, nutrient-rich food program. Um, and then that's like the core of my program. And then we can offshoot in all different areas depending on how much help people need or how much help they want. And then we can branch off into other areas and eventually transition into that food is medicine and lifestyle to keep you in that nice, healthy, healing mindset. And
Excellent.
so
And
that's what I call my
how
3-pillar
long is the
approach.
program?
Excuse me?
How long is the program?
So depending on what it is, anywhere from 3 to 9 months.
Beautiful.
And then of course, it just depends on how involved people are. Some people are just want to get over an episode of an injury. They're just not feeling good. They're kind of sluggish. They have the aches and pains. Um, they're not going to need a lot. They just need to get that nice foundation to really move them in the right direction. And then the people that come to me with underlying heart disease, they're on, diabetic medication, they're on blood pressure medicines, maybe they have an autoimmune with RA or celiac arthritis. They need some more lab testing, they need some supplements, and we work a lot more one-on-one. And those people, we're hanging out 6-9 months together.
Beautiful. Excellent. So
Yeah.
can you share with everybody like how they can get in touch with you and where you're located and all that?
Yeah, I'm pretty easy to find. Everything in my functional medicine business is Peak Total Wellness. And so everything is Peak Total Wellness. My email is steve@peaktotalwellness.com. My website is www.peaktotalwellness.com. And all my social media handles are at Peak Total Wellness. And
Excellent.
there's a link on my calendar to jump on there. And of course, I have a Facebook page, which is Peak Total Wellness. So you can always jump on there. I've been doing Tuesday live. So this was perfect timing, but because it was right when I do my normal Tuesday live. So just to try to get information out there. And my programs are virtual, even though I'm located in the Southern California in the Los Angeles area. My programs are virtual, so I have people all over the country that I work with.
So you can see people from all over the United States.
Yes. Yes. I also have a certification in nutrition and health coaching.
Oh, beautiful.
Along
Absolutely
the way.
beautiful. Excellent.
Yeah.
And the last question I have is, what book are you reading now? Because I love to ask everybody what book they're reading now.
I'm all about like my business, and
Right.
and this is kind of the whole second side of my life, is the business life with, developing 3 brick and mortars and having my medical fitness programs. And now we're in the process of perfecting our wellness and nutrition programs within our office. So I always have these big visions, and creating the vision and then sharing that with my office. And a really great book that I've been following now for the last few years is called Traction. And it's by Gino Wickman. And it's kind of a business type of a strategy or a systems book. And it's about how to create your long-term vision, how to break it down into small steps, and then how to share and lay out that vision to your staff, and then getting your staff to buy into your vision, and then getting your staff on board to really help you, grow and move into that vision. And it's an excellent book. So on the business level, that's a great book if anybody's interested in developing the business ends. But I use that same approach with my functional medicine clients, is laying out the vision. Somebody wants to lose 30 pounds, get off cholesterol or blood pressure medications. They know where they want to be, but it's so far away, it can be unattainable in their mind. Therefore, I do nothing. So sometimes what we'll do is I'll use that same vision approach that I use in my business with their own health. Like, where do you want to be in 3 years? What's your ideal weight? What activities do you want to be doing? And then it's like, okay, in 1 year, how do you think you want to be? And then we talk about that. And it's like, okay, what do we need to do in this short term to get to there? And then all of a sudden, that 3-year vision of themselves becomes a lot more attainable. So you can relate that same approach to anything. And so it's a good read for business, but it's also a good read for laying out that vision and sharing it. Because if you don't share your vision and share where you want to be, it's a lot more difficult to get there. And that's one thing I tell my clients. Once we decide all this stuff, I said, okay, now when you start the program, tell everybody what you're doing and where you want to get to.
All right. That's beautiful. That's a great way to end tonight. Can't thank you enough. I really appreciate your time tonight.
Thank you. Thank you. I appreciate it. It's been a lot of fun.
A lot of fun. I'm sure we have more that we can talk about. So maybe you'll come back on again and we'll do another hour. That'd be great.
Yeah. We can talk about the whole business world.
Yeah, that'd be very cool. All right, everybody. This is Dr. Michael K. from the Center for Functional Health. Thank you very much for watching, and we will see you guys soon.
Excellent. Thanks a lot. Take care, everybody.